Hi, welcome. I'm trying to learn medicine. Today, acute bronchitis, and after we've done it, we're going to do a bit standing yoga. And if you participate in the standing yoga, then it's at your own risk. And this is no medical advice, we're just reading about it. And we're talking about internal anatomy and an illness. Bronchitis. That is inflammation of the larger air passages at bronchi, leading to the lung. There are two categories, acute and chronic. Okay, the large airways to the lungs are inflamed. Okay, we had here in the last part, there's the trachea, for that comes the air down, and then the trachea branch into the bronchi. These are thicker, but they are already a bit smaller, but thicker airways in the lungs. And they can be inflamed, and that is bronchitis. Now the last thing was bronchitis, and that is an increase in size of the bronchi and bronchioles. Now we're having inflammation. Acute bronchitis. Symptoms: wheezy breathing. I still don't really know what it means, but I think I read out the sound. Persistent call. Some people are calling persistently, and phlegm which may contain pus, giving it a yellow or greenish tinge. I don't know. Do people have them all listed down one day? All these secretes, these phlegm and pus, and have a picture to it so that we learn what we are. Are we learning that one day? I don't know. Many people are just using them as if it would be the normal thing of the day to know what pus is and phlegm and so. I don't know. This is something which is in the lungs, and maybe phlegm is a normal thing, but the pus is the abnormal thing, and the pus makes it yellow or greenish. General upset, loss of appetite, headache, fever. Okay, the symptoms of acute bronchitis is a wheezy breathing sound, a persistent coughing, and phlegm to have, which contains pus, which can make it yellow or greenish. And also a general upset. And loss of appetite, headache, and fever. Duration: usually 7 to 21 days. The condition is mild and self-limiting in otherwise healthy adults. Okay, around 1 to 3 weeks. And overall, the condition is mild and self-limiting in otherwise healthy adults. Causes: a number of different germs, viruses, and bacteria which invade the lining of tubes leading to the lungs and set up inflammation. It are the bronchi are inflamed. They say by bronchitis also the bronchioles. Now it would be interesting to know specifically what part of the lungs gets affected by viral infection or bacterial or germ infection. Because it almost sounds as if it would be, at least mostly, separated. That would be interesting and maybe very important to know, and something very easy to know. Okay, a number of different germs, viruses, and bacteria which invade the lining of the tubes leading to the lungs and set up inflammation is the cause. The lining swells. The lining of the tubes leading to the lungs. Inflammation of the bronchi. Okay, the lining swells, narrowing the tubes. Okay, by bronchitis, the bronchi are increased in size. And here, the tubes are narrowed. And the condition is made worse by the outpouring of mucus and other secretions. Does it make the illness itself worse if phlegm is poured out, or is it just if it is stronger than phlegm is poured out? No, imagine if the phlegm has a reason there. Now imagine it comes out like with what's it, cholera? That after one time it leads to dehydration. That where people are giving so much water from them, that then gives the problem that they're dehydrated. Now, what if it is a problem itself of bronchitis that the people are pouring out phlegm? Or is it just when the disease is worse if that happens? The lining swells, narrowing the tubes, and the condition is made worse by the outpouring of mucus, phlegm, and other secretions. Yes, again, mucus, phlegm, pus, other secretions. Is there like a book in a rhyme where everyone sits down and everyone sings them down, phlegm, pus, mucus, and so on? Is it something happening? Or how do all the people know it, or do they not know it but don't admit it? The irritation causes the cause, so the irritation of narrowing, and maybe also that mucus is put out. And the poisons cause the general upset. I don't understand the part of general upset. So I can't really assume now what is happening here with what poison. Acute bronchitis is often encountered as part of measles. Okay, people can have measles. Again, this book is written in the 80s. So maybe we have advanced and measles don't happen that much anymore. Complications. Bronchitis is more serious in babies and in the elderly because there is a greater risk of pneumonia. Okay, if people are young or elderly, and I would add probably also people who have, because they said also healthy adults, if there are some problems, then it is not so good to get it, because it then can result in pneumonia, so more serious inflammation of the lungs. Treatment and how? Stay in bed for 2 or 3 days in a warm atmosphere, day or night. And again, this book is 40 years old, and this is no medical advice. Take plenty of hot drinks and painkillers. This is nothing you should turn it in a sentence, I think. In recommended doses. Okay, they say rest. Take care of yourself and rest. Give your body a holiday. When to consult the doctor? It's working, as if it would be working. When to consult the doctor? If the illness is severe, or if a breathing becomes labor, whatever, some word, or associated with pain in the chest. Okay, if it gets worse, if the breathing becomes labor, whatever, and if there's pain in the chest. If the patient is elderly or baby, then also consult the doctor. What the doctor might do: advise limitation of physical activity. Again, advice to rest. This decreases the possibility of infection being drawn down into the lungs and causing pneumonia. That is interesting. Now here I would like to know if it is a presumption, is that the right word? That can happen then, or if it's like a proven, scientifically, mathematically proven fact that it gets when actually, if people do then activities, that it gets drawn down into the further lungs. I said at the beginning, but it would be nice to know exactly, is actually bronchitis inflammation of the bronchis and not of the rest of the lungs? That would be very interesting. Now if it is, this decreases, now advice limiting of physical activity, this decreases the possibility of infection being drawn down into the lungs and causing pneumonia. If it is actually something, because it sounds like something mechanical, like something which could be measured. Like it is in the bronchis and now it gets drawn down into the bronchioles. It seems to sound like something which can be measured. Now if it is something which is measured, mathematically measured, or if it's just increased chance of it, like we have a feeling that it happens then. I would like to have actual facts on that, because that could be something important. Prescribe antibiotics if there is a risk of pneumonia, and prescribe core medicine. That differences? Whatever, some type of medicine is prescribed, and also to rest. Because they say that the possibility is otherwise increased, that the infection is being drawn down. I would like to know if it is just metaphorically written or actually drawn down into the lungs, into the bronchioles and into the alveoli, and causing him pneumonia. I would like to know what of these are facts and what are words with. Not that I have anything to criticize about what is a word to think that it's not right. It's just I would like to know it really. Prevention. Avoid smoking and smoky atmospheres. What is the prevention of bronchitis? What is the prevention of making it worse? Because it's an infection of germs, viruses, and bacteria. Those at special risks, such as the elderly or small babies, should not sleep in cold bedrooms and should avoid contact with people with colds or chest infections. Okay, people who have chest infections and people with cold maybe should also not be visited so much by healthy people, so should be avoided, and also not to sleep in cold bedrooms. Outlook: acute bronchitis usually leaves now after effects. So the outlook is good after 1 to 3 weeks and it should go away. Now, Now, that was the medical part. If you were here for medicine, then you can go directly to the next part of medicine, to chronic bronchitis. We will do now, I know it again, standing yoga. If you participate in the standing yoga, then it's better if you are risk. Your feet are standing together, and we're breathing in and lifting the arms up. And breathe out the arms again down. Vegan swings. Again, in the arms up. And out the arms down. Let's make power yoga out of it. Breathe again in. And out the arms down. Again, in the arms up. And out them to the side for police officer. Breathe again in the arms up. And out them to the other side. Breathe in the arms up. Make an inch space between the toes, between the feet, and breathe out on the arms to the side. Breathe again in the arms up. And out and we're sinking down. Breathe again and come halfway up. Higher up. And come up again. And out on the arms to the side. Breathe again in the arms up. And out and down. Breathe and come halfway up. Higher up. And up. And the arms down. We're doing a crab in the morning. Legs wide apart. Breathe and lift the arms up. And breathe out, shoulder blades together, open the chest to the sky. Breathe in the arms up. And out again down. Breathe in the arms up, close the feet, bring the hands together, breathe in. And out, lean back, feet in the wind. Breathe again in into the middle. And out, and lean again back. Again into the middle. And out over to one side to find the wind. Breathe in into the middle. And out over to the other side. Breathe in into the middle, make an in space between the feet and breathe out and out the arms to one side. Breathe in the arms up and out to bring the arms over the side down, be going down into the chair. Breathe in, come up again and out on the arms to one side. Breathe in and up again and out again down into the chair. Breathe in, come up again. Breathe in, come high up and now breathe out and come down into the full chair. Breathe in, come up again, all on tiptoes and out and down. Again, in and up. Now the arms over the sides down, we're hanging down. You're doing the marmot, breathe in, bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. In and change. And out and stretch the left leg. In and change. And out and stretch the right leg. Breathe again in and the middle. And out. Just stretch down. Breathe in the penguin, lift the right hand up to the sky, bend the left knee and look over the right shoulder to the right hand. Breathe in and bring the arm in, and out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the arm down, and out and down. You're doing the penguin, make a space between the toes, between the feet. Just away to the heels and breathe in and go down. And out and come up again. Again in and down. And out and up. And the last time down. And out and up. Breathe again in. And out. Just keep normal breathing. Whichever she's comfortable. Take hold on the elbows and gently rock from side to side. Hands again down, feet together. And breathe in, come halfway up into monkey half lift with a straight back. Out and down. In and halfway up. Out and down. Now in the up dying swan, arms up, and the arms again down. Let's do something. The toes are pointing to the outside. If you have something in the knees, feel this exercise a bit more for the knees. And also for the back, breathe in with the arms up. And breathe out, go down. Place the elbows against the inside of the knees. And breathe in and straight up and upper back. Now breathe out, tuck the pelvis in, cover the crown of the head first upwards. The arms down and breathe in and the arms up. And out and down. Elbows against the inside of the knees, breathe in, straighten up. And out, tuck the pelvis in and cover the crown of the head first up. And one more round, breathe out. And again in. And out. Elbows against the inside of the knees, breathe in. And out, come with the crown of the head first upwards. And the arms down. Stretch your fingers, legs shoulder wide apart, intertwine the fingers behind the back, over to one side, breathe in, shoulders back, tall up, and out over to one side, and the chin down to the clavicle, breathe again in, and out pull the arm in and the shoulder down, Breathe in, lift the gaze and turn the head over to the first side, arms over to one side. Bring the chin down to the clavicle. Breathe again in. And out, pull the arm and the shoulder down. Breathe in, lift the gaze and turn the head back into the middle. The sky hugger. Legs are standing together. Breathe in, lift the arms up. And out, lean back, open the arms wide. And in the middle. Out, lean back. Breathe in, arms together and down into doing the cactus collecting its sticks in the evening. Breathe in, lift the arms up. Bring the hands to touch, allow the hands down to heart center. That was the power. I thank you very much and next time.